Hello, my name is Aiden Kiva. I'm a doctor of acupuncture and Chinese medicine, and I practice at Jade Mountain Wellness in Burlington, Vermont. I'm going to talk a little bit right now about digestive disorders from a Chinese medicine perspective, and specifically the way that we discern between different types of digestive disorders and what their underlying causes are. Because this is something really special that separates out the Chinese medical approach from many other approaches to treating digestive challenges. So one thing to understand about Chinese medicine in general, before we talk about digestion specifically, is that Chinese medicine doesn't actually tend to think of illnesses as nouns. We don't think of illnesses as things that you have or things that you get. Rather, we tend to think of illnesses as processes. So an illness is a process you are going through. It's not a thing you have. For instance, when someone has a cancer diagnosis, from a Chinese medicine perspective, it would actually be more true to say they are going through a cancer process, as opposed to say they have cancer. And this might seem like a semantic issue purely, like it's just about the words we use, but it actually can have pretty profound effects on the way that we see the body and the way that we understand the mind, and changes our lens on illness in general and also on health, because health too is understood to be a process. It's not a static state. It's a continually changing process of adapting to our environment from a Chinese medicine perspective. The other thing that is useful about this reframing sometimes is that it can help clients to be a little bit less attached to their diagnoses. And sometimes diagnoses can be very comforting. It can be helpful to be able to say, oh, I have this illness, I have this diagnosis, because it gives us a name to attach to what we've been experiencing. But sometimes diagnoses can actually be limiting, and we can end up becoming very identified with them, and that can change our sense of self and alter it in ways that are not actually helpful and even sometimes harmful for us. So thinking of illness more as a process as opposed to a thing that I have helps us to identify with it less. And there is, I think, healing benefit in that in itself. So having said that, Chinese medicine discerns between, I think you could say, two very broad categories of challenges in the digestive system. And one we could characterize as just weakness. It's just a deficiency, not enough strength in the digestive system. And on the other hand, there is kind of excess of energy. There's too much activity in the digestive system, and that would be what we would think of as a kind of overreactive state. And these two often actually will go together in different ways. So if the system is really weak, it actually might develop a kind of hyperreactivity, and vice versa. Sometimes the hyperreactivity of the digestive system will further exhaust the system, causing weakness. So in our diagnosis, we're always trying to discern, okay, which one of these things is happening? There are many other parameters we consider as well, but this is just one of them. And which one came first, if they're both present, and how do we want to treat that? Now, the important thing to understand about this is that different Western diagnoses, like IBS, for example, irritable bowel syndrome, can actually, different individuals with the same diagnosis can have very different patterns of disharmony from a Chinese medicine perspective. So the root of the issue for one person with a diagnosis of irritable bowel syndrome might be a weakness of the digestive system, not enough qi. But for someone else, it actually might be an excess of energy. Too much is going on there, hyperreactivity. And so we really have to discern. We can't diagnose just based on the Western diagnosis, because we have our own diagnostic framework. Because what we're really looking for in Chinese medicine is to identify the underlying cause. It's not just the diagnosis itself, it's really what is causing those symptoms. It's not the symptoms. We don't generally treat symptoms by themselves. We do treat the symptoms, we do help with the pain and the discomfort and nausea or whatever, but we are always trying to discern what is causing that in order to find full resolution. And so this isn't really surprising in the case of IBS as a diagnosis, because the diagnosis of IBS, irritable bowel syndrome, doesn't really tell us anything about the cause of the illness. All it tells us is what we already know, right? You have an irritable bowel syndrome. It's descriptive, but it doesn't actually give us any more information. It's a bit of a trash can diagnosis, if you ask me. But this is also true with other diagnoses too, and also with other symptoms. So different symptoms even can have different causes, different underlying causes from a Chinese medicine perspective. For instance, constipation can be due to a lack of vitality in the digestive system, a weakness, meaning that the body just doesn't have enough energy to move things out. But it could also be due to an excess, a buildup of kind of stagnation, which is due to too much tightness in the body. And so we have to discern between these two, and we have to treat it properly, right? If we try to strengthen the body when there's a weakness, that will help with the constipation, because the body will have enough energy now to move things out. But if we strengthen the body, and if we get the diagnosis wrong, and we strengthen the body when there's too much stagnation and holding, and an excess of energy built up there, we will actually make the person worse. So this is really, really important. There's not just one way of treating constipation. It's the same with diarrhea. Diarrhea could actually be due to both of those things. Nausea and vomiting can be due to multiple different factors. Inflammatory conditions like ulcerative colitis and Crohn's disease, although they do tend to always exhibit some kind of excess, some kind of excess of energy, they also can have a weakness component, and we have to discern the unique pattern in different individuals in order to treat them properly. This is really key in Chinese medicine. So there's no one-size-fits-all treatment. Everyone is treated as a unique individual. I think that's all I'm going to say for now. I hope this was helpful and informative, and I hope you have a good day.